Well, it's, they have all these different routes that cross, like they do one pickup a day, during the winter months and a school pickup at night. And then during the summer, you just get one. Yeah,
and we were
and
supposed to
they've
get
been
two though.
skipping,
Because
yeah.
there's more traffic in the
When I spoke to
Yeah.
Dale Brewer's staff about this, after the meeting, spoke to, Athena, she said there was supposed to be two pickup in the summer.
Yeah, but it's.
Well, we gotta do our need, assessment need, and
Right.
that, sanitation should be a priority.
We actually need more than two pickups.
Well, yeah, that's what I'm saying, we need to talk about our assessment, and
The trash barrels on the corners, or are you talking about farther from residential street?
Well, both, on residential streets, they pick up in mid-block, but on commercial streets, they pick up only on the corners. And so so you get one pickup on the corners. In residential blocks, they pick up in mid-blocks.
So the light in the middle of 125th Street, they pick up there, right?
what's that?
The light that's in the middle of 125th,
Only
The light.
corners.
they don't.
They only do corners. Because the businesses are supposed to have their own private cars. Right.
The other thing when we were talking about, because we mentioned some of these issues that had arisen, as we expand and as we move towards the forum, we were thinking of, and I even spoke to this with Dr. Smith, that you know how you see something, say something? That we come up with a slogan that can kind of resonate and as closer to the forum, maybe tap into the schools, get the children involved. And have them, some of the teachers or the principals select the children who are really great artists and have them create a nice little, not a mural, but like a handout and don't yuck up Harlem or something like that, something catchy that would resonate with them and draw them in as well. And also, as we reach out to the Department of Health, because it's also major health issue, the Department of Health, the mayor's office, we've reached out to the president's office, but also see what our sister jurisdictions are doing, right? Like Massachusetts has a campaign, when you walk your dog, you pick it up, you pick up your dog.
We've had schools,
Supposed to have
but
that.
we
We're
got
supposed to have that.
Yeah, but it's not enforced. I wanna do the things that can show some results.
Okay,
You know, we, Koch put in the scoop poop or whatever that was.
Yeah,
And
that's
people are
right.
supposed to be fined for it, but we don't have enough employees, to walk
For
behind,
enforcement. It's not
scoop
enforced.
dogs. I just think that dogs, shouldn't be in apartments, in a place like that. That's a different story. Story, yeah, landlords are greedy, so they want.
Okay, I'd like it to just, because with the challenge we're facing, and I agree with you, right? But I hope we don't.
No, I don't wanna do that, but I wanna see some concrete things, some
Yes,
action
actionable
things.
things.
And I think the first thing is to talk to the sanitation,
Yes.
demand that they come to a meeting.
Yeah, that's
And
true.
let's talk about the pickups and that kind of thing, let's
That's
get
true.
them, because Andrew, all last year, they did not attend cabinet meetings.
Wow.
And Barbara said it was a
Okay.
turnover in
Okay.
that, but we gotta let, the mayor office and the borough president office have to be CC'd on this letter.
And
Okay.
and
That we'll press.
the commissioner of sanitation.
And, yeah,
That's because
Commissioner of
because she
Sanitation.
may change him in the middle of.
Right, but we gotta write to her,
Right.
the commissioner of
What's it,
sanitation,
Gothenburg, whatever.
that's her. And CC, the mayor's office and the borough president's office on this. And she's still a city councilman until the end of the year. Yeah, in our city council.
Yes.
Right.
And then I think we also, in our letter, we may need to ask, just have the questions about the policies downtown as opposed to uptown, and if she could speak to those things.
Right,
When we write to her, so then when she comes in, she's not surprised.
what we said,
And what
what
we're
she
saying,
said, right,
exactly.
right, okay. So our letter should talk about, right, okay. The other thing that,
Question.
I Yes.
Procedurally, when will the public get an opportunity to ask questions?
Oh, after we, right after we, get to announcements.
Okay, and I'm sorry, from the agenda, because it's kind of sparse.
Yeah, we only have this, tonight and an announcement, and so whatever you have or wanna add, we can do that after the, committee vote to accept our, outline here that we're trying to, get for, action, plan. So I think the next thing is to get to the health commission.
Oh, that's sanitation.
Sanitation first,
we already discussed.
Oh, it's right, okay,
Sanitation
oh,
is
it's
first,
okay.
and then the health commissioner, because this is a health issue, right? And I like adding the schools to it,
Yeah.
I like the schools, and then especially in District 5, where you can coordinate with the education department, the education committee on this, right, on the campaign. Now, can we have a flyer ready for the meeting of the board meeting,
It's like
November,
it's like November 2nd. It's like really,
2 weeks away,
yeah, it's,
right?
yeah.
How many,
I would have, 1,000 at this meeting, right?
okay, so what is it we want to say?
We wanted to, begin our campaign, cleanliness for Harlem, and things,
How about cleanliness for a healthy Harlem?
Yeah, but it's
I like
cleaner
that.
and healthier home.
Yeah.
okay, clean and have the Harlem, and things we, our community can do.
Okay.
Things that our community can do, and they right here, okay?
But you could market your message differently, like for the churches, you know, cleanliness is like godliness. So you could.
Yeah, when we get to that, but we wanna start at the board meeting, and then we go there with the other partners that we gonna reach out to, the churches, the block associations, right?
So we wanna also use the flyer then maybe to recruit people to come?
Yes,
Okay.
right? And this should go up on the website,
Electronic.
yeah.
And then, Doctor, I believe we can ask at least 5, 15, 20 minutes, African radio show, the Caribbean, and the Indian radio show.
Okay, all
And
right,
I believe that we had
Okay.
in terms of education.
okay. Can you help us with that?
Okay.
Good. Good, okay, that's good stuff, good stuff. We don't wanna leave anybody out in this.
What about the young lady at ACR?
Mhm.
The young lady at WACR
Aisha?
from Harlem High School? Is,
Yeah, you know the woman who used to come.
she used to come down.
Oh, with the radio station,
Yeah.
yes. Oh, okay, we can
Her
pull
name.
our record, right, I can't think of her name
I
either.
know you're talking about.
Right,
I can't
yes,
remember her
yes,
name.
she said anything we had, she would do it, right, okay.
So I can
Now,
take
we
the
have
lead to
some
put
money in
together
our
a
budget.
flyer.
We have money in our budget.
Yes, we
We can help pay for the flyers, we can get it on the Staples, right? A color, I think we need it on color, not on white paper.
Probably can get it done cheaper through a printer.
Oh, you can? You think
Yeah,
they
because
choose?
we print in volume,
Volume.
yeah.
Okay,
Yeah.
It may be half and half, because I know Christina mentions
A black and white,
a
people
black,
with poor
some
vision.
black and white, so people with poor
If there's
vision.
color, they can't see.
Right,
Oh,
right. So some,
okay.
maybe like 750 in color and
okay,
about 250 in black and white, just for the visually to see.
right, okay,
Okay.
right.
So I can take the lead and have my staff to put together some kind of
And
flyer
send
and
it out
send
to
it over
us?
to, send
Right.
it to you to mark it up.
Right,
And
okay, we
then
can, all
like
of us
that.
look at it before
Right.
it go out, okay? And then Fume will help us with the language for
Definitely.
the African community and that, okay?
Okay.
Good, wonderful, wonderful, wonderful. Okay, what else, Barbara, I think this is the beginning
Right.
of it, and working through, I like the, timetable that you worked out.
Right, right.
Yeah, it's a good timetable, because you couldn't have a forum until the spring.
Right.
And you
Right.
wanna tie it around Earth Day, which is
Right.
key.
So we need to have that, walking tour in November, cause after that it's gonna get cold. So we
Okay.
need to figure out,
What
how to
was a
make
good
that
time
happen.
for walking tour?
Well, it's more, you're downtown, we could do a day,
Before I
a
go
night.
downtown, before I go
Okay, so we
downtown.
could do it early in the morning, or we
Okay.
can do it at night, I mean, we got issues all the time, it doesn't matter.
Okay,
Okay, so.
So let's get
for
some
early in
dates.
the morning, if you do early in the morning, you see it before it's clean. You
right.
can see
Wow,
everything that's
that's
there.
true.
Yeah, like
You know.
about 7:30?
Mhm,
Okay,
Okay.
yeah.
so let's look at some dates.
Okay, so we'll get some dates and see when we can do that. And we wanna invite the agencies to come too, or just us? Okay.
The
Agency,
yes.
right. Now, I have to get Bryant to get this letter out to the
Yeah.
commission,
Mhm.
right? I have to get her letter
I
out.
have a thought. Could
Yeah.
we do it? So if we involve the community on our meeting days, we're on meeting one and then forego our meeting for that, then we have a community walk.
You mean like a Monday?
Yeah,
So you're saying
Our
November
next date
21st.
is
right, the
November
21st.
21st.
November 21st, that's coming into
That's
the,
too cold?
yeah, that's coming into Thanksgiving.
Thanksgiving
holiday.
and people
Right,
rallying.
right,
together.
right,
So
right,
it
right,
might be
right,
better
right,
to
right,
push
let's do it a little early. Yeah, it's a good point, but now because of Thanksgiving in there and people traveling, it might not be the most feasible. Alright, I can do a Monday, the 7th, the 8th of November. And then I can do a Monday, the 14th, 13th, and 16th. I can do Monday the 7th. Oh, election day. No,
No, you can't do the
No, I
seventh
can't
or
do
the
it.
eighth.
I can do the 7th.
The seventh,
Yeah,
okay.
because the phone banks are going. I don't have to be
The
there.
seventh is better for me too.
Okay, I can do the 7th.
Sure,
You okay?
Seven for me too.
At 7 o'clock.
yes.
Okay.
Then where will we meet, Barbara?
We can be here, we can board, or
Okay.
downstairs.
Okay.
So now, is Andrew gonna send the invite to the agencies?
Yes, we can
Okay.
have him to do that. Yeah, with, Brian can, I asked him to get, out this to the commissioner.
Commissioner, and also those, people who, the city, the ones that's responsible for those food carts,
Right.
the, what do you call that?
The vendors.
Well, this is the program that the mayor's office have for making sure you get healthy fruit, those fruit carts.
Okay.
Yeah.
And stuff, yeah, so the city regulates those.
Okay. Okay, so we're gonna do the walking tour. Okay, on the 7th.
And you know, we should also do Department of Environmental Protection, because all of that crud goes down in those catch basins, and they don't clean them out regularly, and that's where
The odor
rodents
come
go.
from.
That, and the rodents,
Run
that's
the
where it goes
roads,
down
right.
up in
They
there,
have a
yeah.
field day.
Yeah.
Right, okay. Okay, so the 7th, we'll meet, November the, 7th, we're gonna meet here at 7 o'clock in the morning for our walking tour.
Right.
And Andrew, and, we can leave this for Andrew tonight, right after.
7 o'clock is not early. At least that time to drop the kids at school and then,
Okay, drop the kids off at school,
We don't have that.
okay, can we start, what time do you drop the kids off?
at 8 o'clock.
Okay, what time do they supposed to pick up?
Well, they will not have picked up, but we will. We start at 6, cleaning, we just have one guy that starts at 6, and then
Okay.
I have 4 guys that start at 7. But we will not have cleaned, we will not be down here. We will have cleaned from Morningside probably to St. Nicholas, I mean, to
Okay,
Dayton.
so then you meet us, catch up with us.
No, but yeah.
Right, okay, right, good, all right. Okay, So that's a start, so we can say we got an action, this is
And
an
we can
action
make this
plan.
announcement
Right.
at the next, board meeting.
Right.
With the flyer.
With
Yes,
the
with
flyer,
the
we all have
flyer.
the flyer there, okay? Good. Okay, Ms. Barbara, thank you very much. Now, Dr.
Barbara, now
Samuels.
before the 7th,
Okay,
maybe we'll have you, show. And then, can I have your contact and then?
on it, yeah,
Yeah.
I've been on it, yeah. And now, put the woman's name,
Okay.
WSB, right. We got it. Okay, Dr. Samuels,
A few issues.
okay.
Now, I just want clarity. Someone on the board is also going to be placed on Harlem Hospital's cab?
Yes,
Is that what I'm reading? And who is that person?
Michelle Booker.
Okay, because you know, board members don't wear name tags. We don't know who they are, they just appear. So,
Because we supposed to be getting name tags.
that's why I'm asking.
I'm on the Capitol.
Okay, so,
Myself and Michelle.
okay.
Right, they rotated off, we had Melvin Christian on, and, he rotated off, and then when David Weaver went off the board, we had the vacancy, and Michelle stepped forward for it.
Uh-huh,
And we have Metropolitan, and we have Lincoln, and we have Renaissance.
mm-hmm.
Donna Gill is on Renaissance.
So these are all slots that board members can start moving around to other boards and other boards.
Well,
And other
when
boards.
they meet, the CAB meet, I know here in Harlem, they have the legislative, breakfast
Right.
each year, that they bring in all the, people on budget and all of that,
I know.
yeah. okay.
But I'm just bringing out the point that one of the interesting things of being on the board is that it's used many times for people to get on other boards,
I see, okay,
but not so much for the betterment of the community.
right.
Now, the other issue I wanted to raise,
Could I answer that before you
Yes.
raise the issue?
I didn't ask a question, I just
know,
made
I'm
a statement.
but your statement is incorrect, because.
I said some people use it. Did I say everybody?
But what I'm saying is the reason that we have people on the cab is so that the community is represented in Harlem Hospital.
Is that
and
the
at
reason why
restaurant.
they're on?
That's the reason
Oh.
why they're on. They're on because
Okay, well, that's,
cabs need to have people from the community board
Okay.
to represent the community.
well, that's the reason that you're giving me.
That's the reason that is in the bylaws.
Well, I disagree with that. That might be in the bylaws, but I disagree with how it's played out.
Okay.
Many things can be in the bylaws, but if they're not played out like the intention of the bylaws is, then, you know, it's worthless. Now, the other issue is this. What is this committee doing about homelessness? Since this was an issue that you all had this grand
Yes,
thing
we
over
did. And
at,
today, Dr. Smith, just sent a dude out to try to get us back, and we also have on our plate the 36th Street Association on bringing in another, facilities. And today we got some news that the place that they had sought, they are not looking at that any longer.
okay. Well, I'm so happy I raised it at the board meeting then.
Yeah, well, I was gonna report it, I said I had
The-
some news and it was
Okay,
good news.
but that's all that's happening as far as this committee is concerned.
No, Dr. Smith is following up from the forum that we had,
When was the forum held?
was it June?
It's actually June. That's
June.
June.
And
Okay,
then we went on, vacation, but she is working, continuing to work on that, she just sent out, so she'll be here and see what is the best time for all of
Okay.
us to get back together.
unfortunately, the homeless haven't been on vacation.
Yes,
Now, my next issue that I wanted to raise is that school districts in Harlem are 3 and 5. They're not just 5.
Right.
So you need to include the schools, if you're going to be doing something, you need to include the District 3 schools as well. Now, the next thing is the issue of nursing home. Several people have come to me to talk about the nursing home
the Greater Harlem
on,
Nursing Home.
yes, on 125th
Yes.
Street and on the east side. are you all aware of any problems
Yes.
with that?
We
And
are-
if
we are-
so, what are you doing about it?
In 135, Christine, who's not here tonight, we had the director in, and Christine have written up some things that we should look at, specific that she knows about, with people being removed from the nursing home to Harlem Hospital because they were being neglected and not being able to get the treatments that they need. So Christine Curry have that information for us, and we'll be bringing back that director of the nursing home with specifics on for.
Do you know when you're bringing the person back?
Well, Christine will give us a report, and we will have her back in at the November meeting, the earliest.
Okay, so November meeting. Now,
Yes.
what outreach will be done so that community members will be here for that?
For that meeting?
And what outreach will be
meetings
done
are
regarding,
posted.
and also what outreach is going to be done specific to make sure that the community is aware of this supposedly cleaning up of Harlem?
That's what we're doing tonight. We're gonna put this on social media, on our website, and at the board, at the meeting in November, that's where we're gonna have the flyers for people to take and begin to reach out. We're gonna be reaching out to the churches, and they will get this, and the schools, right?
And that's going to be the extent of your outreach?
No. The social media outreach, they got many emails and things here.
But what about the folks who aren't involved with social media in our community?
We're gonna have flyers.
Right.
That's what we're gonna be.
But that's why I'm asking, what are you doing? Well, that's what I'm asking the board. What are you all going to do? You all are here to take care of the community, right? And outreach
Yes.
to them? So what is your plan for
The
outreach?
plan is for at the board meeting to have the flyer for people to take. The next is to reach out to groups that we already know and to the email list that they have here to go. We will be asking people at the meeting, community people, to take the flyers, and their church, their block association, whoever they have contact with, apartments, please inform them that they know. Now, in my apartment building where I live, there's a place that we can put material for all the people,
Residents.
right by our mailbox. There's a place that the community, what's the paper name?
Harlem News?
Harlem Community News. We can give this to her and ask her to put. We can give it to Victoria Hospital, who's on our on the board, to ask her to put it in there. And some of these apartment buildings, they do allow this kind of information to be put in their places. So
So,
we will get that done that way.
So-
And we're gonna reach out to also, we did mention tenant association,
Yes.
and we did say that this is a living process, it's a growing process, and we will be doing
At
all of the above.
every meeting, we will have the material there and in a 2-minute talk, so people who miss one meeting will know about the next.
But the community, forum in April for
Yeah,
Earth Day.
it's not till April.
That's right, there's not gonna be any actions. It's like, that's gonna be the big
Like big
outreach, you know, it's
Right.
like right now we're still in assessment.
so this will be limited outreach right now.
Yes,
Well, it's
not
actually more
limited.
recruitment.
It's like preparation for the
Preparation
grant
for the actual
outreach.
right.
Well,
This is education.
it's a nice use of terms, recruitment versus limited outreach.
But we're gonna try to do our best, and we're gonna be asking the community to assist us in doing this. And any suggestions that
Well,
the
like
community members have for us, we always welcome that. Right, we welcome.
Well, you can welcome it, but you got to do it.
Well, that's what we're doing now. This is what we're doing. We taking action. We're just not talking about it. We're gonna take some action about it.
And what are you doing about some of the?
An action plan that you think that we.
Yeah,
can-
but you want to pay me?
Can you?
You want?
to pay you?
Yes,
to get-
right. To get it from me,
Okay.
you have to pay me.
Okay, well, we
Like
don't
you
have-
pay other people, you get action
We
plans.
don't
from.
have no money.
Like you pay the other people, you get action plans from. Yes, you are volunteers using the board to move around the other boards. Okay, now, there's a benefit to you. the other thing is, what are you doing about the other health problems in Harlem? What forums have you held on them to have discussions? What outreach was done for those forums?
We've had breast cancer, forum, we've had, we've used, Ralph Lawrence Center, we've used Harlem Hospital, Center. Free mammograms for the community. We've worked with, Emlyn Health downstairs on the health issues. We sent it out, it's posted on our website. People can go for free exercise in the walking tours. And we've also had, prescription drugs discussion here about the program. So we have been very busy trying to educate and give information to our community. This young man here, who came to us last month about a program that is for our residents here in Harlem. We invited him to bring his material and make a presentation. It's a good program, but some of our seniors do not want to go to programs. They rather stay home and watch TV all day. But we are giving the information out. We have sent them, told them about the Baptist Ministers Conference. We've given them information of other places they need to reach out to. The Kennedy Center, where there's a program for seniors there, but it's not as comprehensive with what they got to offer. So that's what we are doing, and we are trying to educate the community on health as well. That's our theme.
Well,
We want a healthier Harlem.
I have to scoot to another meeting. However,
Well, thank you for coming.
let me say that I have to question seniors wanting to stay home and look at TV. And there's a little more I'd like to say on that, but I gotta go.
Well, okay, but
But
Dr. Samuels,
I believe-
use
I
that
bel-
as a widespread, but I live in Building 10, and in Lenox Terrace. I have given information to my seniors there. I have talked to them, and they do not want to engage outside of their residence. They sit in the lobby,
Then that's where you go. If that's where they're sitting, if that's where the
That's where
elders
I
are,
live.
that's
And
where you go.
Even the owner of the building has, was fighting the use of the lobby for, recreation and social gathering. And we had to get on them.
Well-
Now, don't run our seniors out, they pay their rent.
Well,
Let them sit there.
just
But the chairs and things they have there is not for a recreation center.
Well, let me just say this. Remember, Dr. Dukes,
Yes.
that you voted to not allow the community of North Harlem to have a library where they could get this kind of information.
Oh, no.
I was at the meeting.
Oh, no.
I was at the meeting. I can testify to it.
Okay, you gonna get a beautiful, library?
Where? In another housing project? Is that where we're gonna get it? Or a freestanding one?
I thought it was a freestanding one.
Well, you need to check that out, because somebody's making decisions without talking to the community again.
Well, I'm not on that board.
But you know about it, didn't you? But you knew about it.
I heard that they were gonna give the McCoon Library.
Well, that
space.
you may have heard about it, but the community has not been brought together for a meeting relating to that. And I don't want to get lost in that without going back to the fact that when we had space for a library that could have been used for community outreach and for my community to learn along with a multifunction recreational facility, you voted against it.
Put down on your committee.
That would have helped my community in terms of health issues.
Yeah, I know about it.
Just to clarify, the Arch Care program, yes, we do have a recreational component.
But also,
if
you take only certain insurances.
Only Medicaid and Medicare.
Well, the problem is, some people have other insurances, like insurances that are paid by annuity and whatnot, you don't take them. We gotta be clear on exactly what services are being provided by anybody. I'm not knocking the program, because I'm Catholic and Arch Care comes out of the Catholic Church. But they don't really take everybody, and you can be left hanging looking for Arch Care. That's all I want.
As long as you have Medicaid and Medicare,
I know,
we
but
can work with you.
But
So-
listen to what I'm saying. If you are an Inuit, an elder who worked for the U.S. government for years, and you were never given Social Security, okay? That's never been corrected. You're out in the cold. Not only with your program, but with many programs. So this is something that would be helpful even for the health committee to look into.
Well, we're working to try to get as much information that we can from the people that come and present to us and give us information. So